Alright, so today I'm going to do an airway clearance, and today I'm going to do it with an acapella. And so this will help them get their secretions out of their lungs and help them breathe better. So first off, I'm going to check the patient's charts before I enter the room to see if they have a nebulizer treatment. So that way I can do it before and then after their treatment. That way I can get their lungs cleared up after treatment. So I'm going to come into the patient's room, introduce myself, always knock on the door, and then I'm going to check the patient's ID band, and then I'll wash my hands, dry them, and then I'll auscultate the patient's lungs and get down the vital signs, anything that I may need to, that way I can place that in the charts before I do the procedure. And then I will set the patient up to where they're comfortable sitting upright. So if they're laying down, I'm going to instruct them that I'm going to move their bed up and move them up. And then I will go on and put either like a bedside table, that way they can rest their elbows on something when they do the breathing treatment with acapella. So with the acapella, here's the acapella, so it has a flutter valve inside, so you want to set it at the least resistance, especially for an elderly patient. That way, when they do it, sometimes elderly patient can't get that strong enough expiratory rate to blow through to get that fluttering in their lungs to get that secretion out. Alright, so here I have an acapella, what's called an acapella, and I'm going to set it at the lowest rate to start you off with. That way it's a little easier for you to start with, and then we will increase it as your lungs get stronger and are able to cough up those secretions more. So when you're holding this, you don't want the patient to cover this. You want to leave this open because there's a little valve in there that will flutter when you exhale out, okay? So you want to hold it kind of like a microphone, okay? So you're going to hold it like you're going to sing here, and we're going to take a deep breath in, and then we're going to exhale for about 3 to 4 seconds. So you want to, for a patient, you want to have an IE ratio of 1 to 3 or 1 to 4. Alright, if you feel any dizziness or anything like that, please let me know. That way we can take a break, and we don't want to overwhelm you with this. Don't want to overwhelm your lungs like that. So let's go ahead and we'll practice. I want you to breathe through your mouth, not through your nose. So we're going to take a deep breath in and exhale. I want a strong exhale, but we don't want to do forcefully to where it's not going to do its proper, the way the machine will work properly. Alright, so I'm going to put this here with you. I'll have you hold it, and I'll take a deep breath with you, and we'll exhale, okay? Ready? And exhale. Alright, so once we exhaled, we'll do this about 4 to 8 times, 10 to 20 minutes. That way we can get your lungs cleared. But if we can't do that many times, that is okay. We'll work our way up there, and we'll get your lungs clear and open. That way you can breathe better. So when we are done with this, I am always going to check to make sure the patients are okay. And if they do cough up something, I need to make sure I know the consistency of what it is, the color of it, if it has any smell, anything like that that comes with the sputum that they may cough up or anything like that. And so I'm going to place this in the appropriate bag. So this is a device that they can take home with them. That way they can continue to practice at home to get keeping their lungs open, especially if they have to do nebulizer treatments, anything like that. And with this, you can hook up a nebulizer, but you don't want to, because the particles from the nebulizer medication can get clumped up in there, and you can't take this machine apart to clean it. You can only wash the mouthpiece. So I'll place it into their appropriate bag, that way they can take it home with them. And then I would wash my hands after any treatments that I do, and then I would put my gloves on, and then I'd reassess the patient to auscultate their lungs, get their vital signs, and see how they're feeling, if they're feeling faint, if they're conscious enough, like if they sound kind of disoriented. I need to make sure I chart that and see what's going on. And as always, if I do a breathing treatment, if they had a mask on or anything, I always need to make sure their oxygen is at the appropriate level. and then I would go and chart this on the patient's chart and let the doctor and nurses know that I did a treatment for them.